Welcome to Enjoy Birth's Know Your Choices Childbirth Series. Today's segment is on inductions. As usual, this is not meant as medical advice. This is just information so you can have informed conversations with your care providers. Then you can make the best decision for you and your situation. Why is it important to learn about inductions? Well, over 40% of moms' care providers today try to induce them. And over 47% of moms today receive Pitocin during their births. So it is important to learn about inductions and be proactive about them because they can carry many risks. Here are 5 risks of inductions. The first is that it may not work. If your body is not ready to have your baby and the baby's not ready to be born, then an induction most likely will not work, which then increases your chance of ending up with a cesarean. A good way to tell if your body is ready is to find out your Bishop score. Your Bishop score is determined by doing a vaginal exam and giving your cervix different rankings based on if it's soft, if it's posterior, how dilated and effaced you are, and this will give you a score. And if your score is over a 9, then an induction is most likely going to be successful, meaning you'll end up with a vaginal birth if all goes smoothly along the way. If it is below a 9, then it's likely to end up in a cesarean. You can see why it would be important to know what your Bishop score is before making a decision regarding an induction. The second risk is that it can cause stress for the baby. A lot of the medications that they use to induce a birthing time can cause very strong pressure waves, which can then cause distress for the baby. Another risk that's related to the strong medications that they used is that it can also exhaust the mom and make her tired. They often have moms come in at midnight for an induction. This is really for the doctor's convenience. They'll put in a cervical softener, which we'll talk more about later, and then in the morning they'll start Pitocin. Even before mom's active birthing time starts, she's exhausted because it's difficult to rest in a hospital overnight. The doctors like to do it this way because then mom typically will birth the baby during their normal business hours and they won't have to get up in the middle of the night. So because her pressure waves are strong and powerful and mom's tired, this can lead to the fourth risk. If mom chooses to get an epidural, then she's stuck in bed and her birthing time might not progress as normally and as quickly as possible, which can then lead to more interventions. You might be thinking, well, I'm planning on getting an epidural anyway, so does it really matter? Well, it does if you're trying to avoid a cesarean. A cesarean is our 5th risk, because an induction can often be the first step down the road to a very intervention-filled birth, and is much more likely to end in a cesarean, compared to a birthing time that starts on its own, when mom's body is ready and when the baby is ready to be born. With all these risks, you might wonder, why would anyone get induced, and is it a good idea? Sometimes an induction is a good idea, and I'm going to go over 5 reasons right now. The first is preeclampsia, or toxemia, and this can be a serious risk to mom and baby. Basically, it's high blood pressure that can cause problems for mom, and the only solution is to have the baby. If a mom is told she has this diagnosis, she would just want to be sure it really is preeclampsia and not just a few elevated blood pressure readings. And there are many different things a care provider can look at to determine that it's truly preeclampsia. So before agreeing to an induction, a mom might want to do potentially a 24-hour urine collection and a liver panel to confirm the diagnosis. I have links on my site to explain more. Sometimes care providers will just suggest a mom go on bed rest and monitor her closely. If a mom is in this situation, she may want to look at upping the calcium and magnesium and protein in her diet, and I have links for more information on this as well. The next good reason for an induction is intrauterine growth retardation. This is when the baby is not growing as quickly as expected and can sometimes signify that they're not getting enough nutrients, so this would be a good reason to be induced. Another good reason for induction can be post-date babies. This is for a mom who is more than 42 weeks pregnant. The risks to mom and baby do statistically increase after 42 weeks gestation, more so in high-risk moms. So a mom might choose to get induced at this point. Another reason is premature rupture of membranes. If a mom's water breaks before her birthing time starts, most care providers are anxious to have the baby out within 24 to 48 hours. The reasoning behind this is because that barrier between the outside world and the inside world to the baby is broken, and it can cause an increased risk of infection. As long as mom is not getting vaginal exams, her risk will be lower for infection. And most moms' birthing time will start on their own within 24 hours after their water breaks. It is pretty standard for them to want to start an induction within 12 hours of a mom's water breaking. If mom and baby are doing well and not showing signs of infection, it may not be necessary. So you'd want to ask a lot of questions. Am I okay? Is baby okay? And see if you can wait. But after a certain point, most care providers are definitely going to want to get the baby out within a certain amount of time. So if your birthing time does not start on its own within that time period, then an induction would be your next choice. The fifth reason is low fluid levels. This can certainly be a reason for concern, especially if the fluid level is below a 5. But it seems to be a new trend. I've seen about 6 different moms in the last year be told that their fluid level is low and head to the hospital now. But their levels were actually between 10 and 5, which is something certainly to watch if the baby is doing well. Some care providers have a more expectant management approach to this low fluid level situation. If a mom is below 10 but above 5, as long as the baby is doing okay, they may send the mom home to drink 2 liters of fluid and come back the next day to have her fluid level remeasured. It may very well have gone up. If not, then again, it's something to ask more questions about, and it might be a good time to have an induction. Now that we talked about the 5 good reasons, or potentially good reasons to be induced, let's talk about 5 very questionable reasons for induction, but ones that might be suggested to you by your care provider. The first is that your baby is quote-unquote late. Well, this is different than the post dates that I talked about above. That was for babies that were after 42 weeks gestation. Your estimated due date is not an expiration date. Between 37 and 42 weeks is considered full term and is a safe time to give birth. But increasingly, I am seeing moms feeling pressured into inductions at 41 weeks, or even 40 weeks or earlier. Why is this? Well, statistically, there are not better outcomes for moms who induce at this time. For a lot of OBs, it's just their normal routine. They like to induce at a certain date. If you and the baby are okay, it's much easier and safer for you and the baby if you wait for your birthing time to start on its own. And remember that statistically, most first-time moms don't even start their birthing time on their own until after 41 weeks. So, this is something really that you want to talk to your care provider about now, and we're going to go over questions you should ask, and this is certainly one. Some care providers are fine with moms going past 40 or 41 weeks pregnant, but they want moms to have non-stress tests to reassure them that all is well with the baby, and that's a nice way to go about avoiding an induction and reassuring yourself and the care provider that all is well with your baby. The next big reason that I'm seeing moms get induced for is the big baby scare. This one is really common today, where moms are being told, oh, your baby is getting too big, so we need to get the baby out now. Some care providers will even suggest going straight for a cesarean because their baby is so big. Well, this is not really a good reason to be induced. Even the American College of Obstetrics and Gynecology says it is not a good idea to induce for this reason unless they think that the baby will be over 11 pounds. Well, it's very difficult to determine. It's actually impossible to determine how big the baby is going to be until after they are born. Ultrasounds can be wrong up to 2 pounds, above or below what they're guessing it is. And so it's not a good reason to be induced. Unless there is something wrong with you or the baby, your body is going to grow the perfect size baby for you. I have a whole page on big baby bulb. I will have a link to that on our link page. The next questionable reason for induction is low fluid level and premature rupture of membrane. We talked about those up above as good reasons. And I think typically they usually can be a good reason, but you really should ask a lot of questions and really trust your intuition. Remember that for low fluid level, under 10 is something to watch, and under 5 is probably something to act upon. The fourth questionable reason for induction is mom is just tired of being pregnant. I know those last few weeks of pregnancy can feel really long, but babies need to grow until they are ready to be born. This leaves a 5-week window of normal, 37 to 42 weeks, so you should be willing and ready to go the distance. One of my tips is to add 2 weeks to your guest date and tell everyone that your guest date has changed. Let's say you were due October 1st. Now you're going to call everyone up and say, oh, now I'm due October 14th. And in your mind, make that mental shift. Say, I could be pregnant until October 14th, and that is okay. Some moms get really fixated on that guest date and are really disappointed if the baby isn't born by then. If we can change our mindset about it, it will help us to be able to wait until our baby is ready to be born. If a mom really feels like she needs an induction because of her comfort, she should take the time to find out what her Bishop score is and make sure that it's favorable for a good outcome. If it's not, then waiting a few days or a week or so is a lot less risky and going to end up to be more comfortable than recovering from a cesarean. The last questionable reason for an induction is convenience, and this could be on the part of the mom or the care provider. It's interesting, but there's a lot more babies born in December than any other month, and there's studies that show that it's most likely due to the holidays, and care providers are going out of town, and so they want to schedule their patients to have their babies before they leave. And moms often have convenience issues. They know that they will have their mom in town to help with their other kids at a certain date and would like to have the baby then. Or any other various reasons that it's more convenient for a mom to be able to schedule when her baby is going to come. The mom should just be aware of the risks and make the best decision for her. There are always more risks of unexpected complications with an induction than when a birth starts spontaneously. It is important to ask a lot of questions to your care provider early, meaning your very next appointment, even if you are only in your first or second trimester, about their induction routines. Why would this be so important? Well, on the blog that's out, My OB Said What, you can see this lovely comment. It's so weird that you're in labor. I haven't had a mom go into spontaneous labor in over a year. What do you think the odds would be of a mom starting her birthing time on her own if she had that OB? It would be pretty low, and most likely she wouldn't even know it until he was pressuring her into an induction. It is a challenge to change care providers that late in the game, though it is possible. I had a mom on the HypnoBabies Yahoo group named Angela who was in that exact same situation at 40 weeks being pressured into an induction even though she and the baby were okay, and she did change care providers. And there's a link to her story on our link page. But ideally, we're going to talk to our care provider much earlier and find out their normal routines, and here are some good questions you can ask them. A good first one is, what percentage of your patients do you induce? Then you can ask, when do you normally suggest an induction? What will happen if I'm still pregnant at 41 weeks? Do you allow, quote unquote, your moms to go to 42 weeks? And then ask them what their normal routines are when they do induce a mom. For example, this is the time when they might say, well, normally I have a mom come in at midnight to start a cervical ripener. And you could ask, well, would you let a mom come in the morning instead? Their response to these questions should give you a good idea about what their normal routines are for induction. This is the end of part 1 of the induction section. Please take a short break, stand up and stretch before listening to part 2. You will definitely want to take the time to watch or listen to part 2 because we will continue with some more important questions that you need to ask your care provider, as well as other tips to help avoid an induction and natural alternatives to an induction.